When I have to laugh, compliance is not scary. It should not be scary. And if it is scary, then something's wrong.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, I'm excited to welcome Rachel Anderson, a nurse who brings her passion for quality and compliance to her role as a lead solutions specialist. Rachel's path into nursing was sparked by a traumatic brain injury at the age of 18, which gave her a firsthand understanding of patient care in the healthcare system. From working as a nurse in large trauma centers and small rural facilities to taking on leadership roles and driving policy enhancement, Rachel has leveraged her experiences to deliver meaningful solutions across the healthcare spectrum. In this episode, Rachel shares her incredible story, her passion for helping patients access the right resources at the right time, and her insights into process improvement and program development. Welcome to the show, Rachel.
Thanks, Audrey.
I'm so excited to have you here today. You bring a really unique perspective to your journey. And so I would love to jump in at kind of the beginning of your story, and I'll let you kind of choose where you get us started off with how you even ended up in nursing in the first place.
I was in my freshman year of college. I was driving too fast, of course, as most teenagers do. Took the exit too fast and lost control. I ended up, like you had said, sustaining a traumatic brain injury. I was in the hospital for a total of 12 weeks. First, I was in the ICU, then an acute care unit, and then I spent the majority of the time on an inpatient rehab unit. And while I was there, there was one nurse in particular who made a very significant impact on me and my family. Just the quality of care that she provided. And then she would do things like, the show ER was really popular at that time. And she would record it at home and then bring it in the next day for me and my family to watch. So like I said, huge impact. So then after I recovered from the brain injury and started going back to college, I needed to figure out, okay, what next? What am I going to do now with the rest of my life? And I decided, because of Michelle, that nurse, I ended up going into nursing school. And when I graduated, she was in fact the nurse who pinned me, or the person who pinned me in our pinning ceremony.
Oh my gosh, that's incredible. I love hearing stories like that of nurses who really do make that lasting impact on a patient and their family. I think that that's something that as nurses, we all kind of strive for. Like, we want to be that person. So,
Right.
I mean, what a silver lining to a bad situation Michelle must have been.
She was just absolutely awesome. And well, and then after I finished school and I took a job on that same rehab unit. She was actually my preceptor on the unit, helping to orient me to. So it was really pretty cool and full circle.
That is so cool. And I feel like that's so rare. I mean, I think that a lot of the times, we take care of patients and never see them or hear from them again and never really know how they're doing in life. So how special to be able to kind of come back together, her see how well you're doing, and then be the one to be able to guide you down that nursing path. That's amazing.
It was very cool.
And so you started off, did you say you started off as an LPN working on that unit?
So I got my LPN, and then as I was working on my RN, I was working on the inpatient rehab unit. And then once I got my RN, then I just transitioned to an RN role on that same unit.
Nice. Okay. And then how long did you work there as an RN before you moved on to something different?
So the timing of everything. So I finished school. I finished with my RN in May of 2002. Then I was actually getting married in September of that year, and I moved to a completely different health system. So I left that job. I did come back to that inpatient rehab unit, I think about 5 or 6 years later. But I was only there probably about a year and a half in total with my LPN and RN. Then I moved and then I bounced back and then spent another probably 5 years there.
Cool. And I mean, I'm sure that you probably had your own experience in your mind while you were working on that unit. And like, I can just imagine, wanting to kind of be the person on that unit to make that same kind of impact on someone else. So it's really special that you got to return there and spend so much time there.
Yeah.
And then you went on to pursue your MSN. Did you know from the start that that's something that you wanted to do?
Yes, when I started nursing school, as much as I was looking forward to bedside nursing, I felt like I'm going to say this, and I'm not at all diminishing bedside nurses because that is hugely important and cannot be without bedside nurses, we would not have anything else. But I also felt like I had more to offer. And so I knew I wanted to go on and get my bachelor's and my master's.
Gotcha. Yeah. And, I can appreciate what you're saying because I think that, working at the bedside, we make just like Michelle, like we make a hugely important impact on our patients every single day. But I think that there's also something to be said for being able to take on other positions, whether it's in like, a path like yours or healthcare administration or something totally else, something totally different that's non-traditional, and being able to kind of broaden that impact beyond just like your however many patients you have every day, and being able to broaden that scope of where you're able to create an impact. And so once you did get your MSN, what types of roles did you take on from there?
So I got the MSN with an emphasis in healthcare policy. And my very first position after obtaining that degree was I was director of a different inpatient rehab unit. So still sticking with my post-acute love. I did that for a couple of years. And then the health system that I was working for had an ACO, an accountable care organization, that was looking to expand their post-acute footprint throughout the state. Basically, wanted to help facilitate connections between the acute care hospitals, the larger acute care hospitals in the 4 quadrants, with the skilled facilities in the area to hopefully help improve quality of care, set up some standards, transition standards, quality of care standards at the facilities to help prevent patients from bouncing back to the hospital and just to overall help shorten their length of stay in the skilled facility. So I took on that role. I did that then for a couple of years.
How do you think that your experience to that point, both as a patient and a nurse, how do you think that that colored your perspective stepping into that role?
So as a patient, I understood about bumpy transitions of care and what that looked like and felt like, not only from the patient perspective, but then also from the family perspective. And then also from the bedside nurse, I had worked in bedside long enough that I know the workflows. I know the pain points for that nurse when he or she is going to be sending a patient to a skilled facility or needs to call report, or we're waiting for authorization for that skilled facility, or whatever the case may be. So it allowed me to walk into that role really having a good understanding of what patient or what all the participants were feeling and what their concerns were. And so then I could, in conversations with them, I could talk with them directly about those concerns and whether it was me making light of a concern in order to bring up conversation and get some more input and then talk through how we would work through that concern, or just me being able to step back and say, okay, what are your concerns?
Yeah, I think that having that unique perspective of both having been on the patient side and the nursing side is so valuable in that type of position because, I mean, that's everything, right? Like the patient, the nurses, like the workflows, that's what all of this is about. And so having someone who's been on both sides of that equation and can provide that insight, I think is just so crucial. So I think it's awesome that you like found your way into that opportunity. I know that because of your experience, you put a strong emphasis in your work about, having the right resources at the right time. How does that perspective kind of influence, I guess kind of what was the root of that perspective and how does that influence, what you bring to your work and quality?
So, having the right resources at the right time is hugely important when you're recovering, especially when you're recovering from a brain injury. I can honestly tell you that because, not only because of God, but then because I had the right rehabilitation at the right time throughout my recovery process, is why I obtained the outcome that I did. Um, I mean, I went to nursing school and got all my degrees after my brain injury. You don't often see that. And I don't say that to brag or anything else, but just to really show that 20 some years ago, we as a healthcare system seem to do a little bit better at getting those right resources at the right time.
Mm-hmm. Yeah, that is
But
so
in the
crucial for outcomes.
Absolutely. But then in the answer to your question, then that experience has helped me, for example, lining up resources. My grandma was at home for years. She was living at home. She was in a situation where she needed extra support. Well, because of my experience with getting the right resources at the right time and understanding the importance of it, I was able to layer in, not only private caregivers to come in and help her out, but then also we eventually lined up hospice services and then took her to the nursing home. So we were able to layer in everything that she needed at the right time to help honor her wishes.
Absolutely. And that's actually the perfect segue into kind of what you ended up doing with your career next. Because after the ACR, you ended up taking on roles in discharge planning and care coordination. So tell us a little bit about how those roles and how you continued to kind of like grow and develop professionally as you took on new things.
So when I was working at the ACO, I was traveling the state. So it was long days. Not every day, but several long days. Well, then I ended up pregnant with our son and realized traveling extensively was not going to be very conducive to motherhood. So I took a job at a local critical access hospital, again, doing the discharge planning, care coordination. I also oversaw their swing bed program and the compliance program as well, I added on. Those roles, especially the care coordination and the utilization, really showed me very, very quickly how to advocate with payers for patient needs.
That's important. And I mean, advocacy is such a huge part of what we do as nurses. And I think, an unfortunate number of times working at the bedside, we often feel like we are so strapped for time that advocating appropriately and like educating and all of that kind of like falls more to the wayside than we would like for it to. So being able to take on this position away from the bedside, be able to really advocate for your patients and in a way that is like really impactful. I'm sure that was fulfilling in that new role.
It was, and it it meant a lot to me when I was able to connect the patients with the right resources as they were leaving the hospital, whether that was home care or hospice or even outpatient therapies, getting them what they needed at that point in time.
Yeah, and tell me some about how you feel like your clinical knowledge that you developed while working bedside kind of played into doing that.
So I had a good understanding of what the patient was getting while they were in the hospital with us. Whether it was IV antibiotics every 12 hours or wound care. So then when I was calling for referrals for the outpatient IV antibiotics or the in-home wound care, I was able to better articulate what the patient needed and what supplies. And I was better able to anticipate the questions that the referring agency might have.
Yeah, definitely. And so it was through these new positions that you kind of discovered this love for policy and compliance. Is that right?
Yes. And it happened at the small hospital that I was at. Our compliance officer was retiring shortly after I started, probably about 4 or 5 months after I started. He announced his retirement, and I thought, I love reading rules and regulations. I know I'm kind of a geek there, but I love reading rules and regs. So I went to our hospital CEO and I said, what are you thinking about doing with this role after he leaves? And, he said he hadn't really thought about it. I said, well, I would love to take it on. If you're willing to get me the education that I need to do this, I would love to take it on. And so I was able to add that on to the other stuff that I was doing at the time. And it was a lot of fun.
Yeah, I love that you went to them and just advocated for yourself and said, "Hey, I see this opportunity. I want it. Like, let's work together to make this happen."
He might have looked at me like I was a little crazy, though. I'm not going to lie.
Hey, that's all right. He must have, you either had a really convincing argument or he must have had already had a lot of respect for you or a combination of the two. He knew you were the person for the job.
Hopefully, one of those two, yes.
So, talk to me about kind of the next step after that. How did you go from I mean, it kind of was a few roles on your plate at the time. And so how did you go from that into consulting?
COVID happened, and I just got tired of being in the hospital. So I
It was a
started
hard
looking,
time to be in the hospital.
yes. And I started looking for other opportunities, and I found a role as a healthcare consultant with a national consulting firm. They did everything from accounting to due diligence when private equity companies were going to be purchasing, say, ambulatory surgical centers. So went through the application and interview process with them and ended up accepting the role. And my primary focus, at least at first, was going out and doing these clinical assessments on these ASCs that were going to be purchased by the private equity firms. So I would go on site, and depending on what I was assessing, I'd spend 1 to 2 days on site. If I was just doing the nursing or the clinical component, it would be 1 day, and I would go in, I'd change into their scrubs. I would spend a day in the OR with them, start out by tracing a patient through, similar to a Joint Commission tracing the patient all the way through the process, just really observing everything. Watching how, for example, sterile fields were maintained. Were nurses doing good hand washing or hand hygiene, alcohol before injections? I mean, things like this. I was just observing and taking a ton of notes. Then if I was going to be on site in 2 days or assessing also the business side of it, I'd go back either the next day or I would have done it the day prior and spend a day with the more administrative side of things, talking about how do they do their billing. What's their process for that? How do they, when they take copays the day of, where do they store those? Are those kept in a secured, locked environment? When I look at the desk, is there patient information strewn all about? Looking through, again, similar type assessment, but just more on the business side of things.
Yeah, interesting. And so then once you kind of made your observations, how was that information then used by the decision makers?
So then after I finished, then I would write up a report and with all of my information on it to be given to the private equity or whomever hired us to do this work, to be given to them. I would also give out a verbal report. We'd have a Zoom call and I'd go through and do highlights I wouldn't go through all the nitty gritty, but the highlights of, this is a red flag you may want to check into, or after the purchase goes through, you may need to do some more education on this, or whatever the situation was. Also, if the facility was doing really good things, I made sure to highlight that too. So that way the private equity understood that, even though, yeah, they may have these little things over here, they're doing this really well, just to help give more of a balanced perspective on it.
Yeah, I like that. And I'm thinking back to like when I worked at the bedside and I don't know that it would have been anyone like in your like same position, more so probably just like joint commission being there. And, all nurses are kind of like on our best behavior when we know that someone is around watching.
Yes.
So, I do like that you had been a nurse and like you kind of knew how things were supposed to go and you could provide that perspective. And, you could also, as you said, like you could point out the things that were really good. And I'm sure that you saw a lot across a variety of facilities, things that were done well and things that were done not so well.
Exactly. Yes. And it was fun too, because since I wasn't with a regulatory body, when I would go in and meet with these ASCs and chat with the nurses, I made it clear to them, I'm not here to get anybody in trouble or do anything like that. I just wanted to take notes and write my report. And I was able to establish that camaraderie with them. And we had, some of the facilities that I went to, we had a great time. Just some really neat nurses that I got to meet.
Yeah. Yeah, that's nice. And I think that there is that nurses have this innate ability to really quickly establish a connection with one another. It's like, as soon as I know that you're a nurse and I'm a nurse, like, we're good. We're going to be friends. So it's great. I mean, I guess it's also like pressure off that you're not there with a regulatory body, but it's cool that you were able to go in with your nursing background and make those connections at the facilities that you were there with too.
It was fun.
And I know that so tell me some, I guess, about like working with quality improvement, then with like Medicare and Medicaid. When did that shift occur?
So, towards the last fall, the consulting company that I was working for, they had a change in the type of work that was being asked of them. And it was less of the clinical type of work, and it was more of the coding, doing a coding analysis and coding checks and all this. And I've taken the coding education for the outpatient coding certification. I have not taken the test, but I will tell you, my nurse brain does not function in 5-digit codes. I I can do the medical necessity coding piece of it, not a problem at all. But with a lot of it, no, I can't remember all those codes. So anyway, my position was eliminated. And so that kind of left me with okay, what now? Well, as I was looking for work, I saw a position with a quality improvement organization who does a lot of contracting with Medicare and Medicaid services. and I did obtain a position with them. First, I started out as a healthcare quality educator, and I will be transitioning into a role lead solutions specialist. But when I started with the healthcare quality educator, it's been a lot of providing the educational support that our hospitals may need. Say, for example, sepsis, helping get education out to the hospitals, whether we're doing a collaborative, a series of webinars, or we're just doing a one-off about something new in sepsis that has come out, or a refresher. I'm part of the team that helps prepare all of that education.
What is the process for determining what education is needed at which facilities?
So most of the education that we provide, at least the things that I've been working on, are not facility specific. We do have nurses on our team who work with individual facilities on whatever project is most important to that facility. So, for example, as a larger group, we may decide, like I said, that we need that sepsis education. But then there may be this one hospital over here that the person who is working with that hospital, they feel like they need to work on CODIs. And so they're working on CODI, but yet they're still part of the opportunity to receive that sepsis education.
Gotcha.
Does that make
Okay.
sense? Okay.
Yep. Yep. And so are you primarily then at this point working with hospitals, nursing homes, a combination? What types of facilities are you working with educating?
So the contract that I originally started with, we are working with small rural hospitals or tribal hospitals throughout the country. This contract is actually ending next week. And on Monday, like I said, I'm starting a new role, and I will actually be helping to establish the quality measures going forward for post-acute across the continuum. So skilled nursing facilities, nursing homes, home care agencies, hospice, and I think we're also going to touch on psych services as well, inpatient psych facilities.
That's interesting. Well, okay, so a couple of things. One thing on your current job that's going to be ending soon, the fact that you're working with rural facilities and tribal facilities, I'm sure has been a very unique experience. What would your like takeaway be between, larger facilities and the needs and like quality and compliance things that you see at more rural and tribal facilities?
Working in a rural, and I've never worked in a tribal, but I can only imagine, you have to get creative because your resources are not as, you don't have as many resources in those facilities as you do in a large urban hospital that's part of a large health system. So it's, like I said, when I worked in that one critical access hospital, I was discharge planner, care coordinator, oversaw skilled, you wear many hats. Well, in working with these rural facilities or rural hospitals, it's the same thing. You have one person who is wearing multiple hats, and they may not have the same quality priorities that we do. So we very much need to meet the facility where they are at. And what's keeping you up at night? What are the problems that you and your hospital want to work on? And let's start working on those. And then we can get to this other stuff later.
Yeah, that makes a lot of sense. I mean, I know it had to be a different approach for rural and tribal
Yeah.
facilities versus like your large level 1 magnet facilities that have a ton of a ton of resources.
Right.
Whenever I'm talking to nurses about transitioning from like bedside clinical world into like non-clinical business world, and we're talking about like the different size of companies that you can go and work for, like whether it's a like large business, large corporation versus a startup. I always compare the startup environment to a rural like community facility because it is like a very scrappy work environment. You have to wear many hats. You have to just kind of like be resourceful and make things work. I think that there's a lot of parallels to be drawn there, but I would say in business or in healthcare quality, you couldn't approach either of those two buckets the same way. It has to be different.
Exactly. And then even with that, one critical access hospital is not going to be the same as the next critical access hospital. So it's a very individualized approach.
Yeah. Well, I also caught that in this next role that you'll be moving into, that you'll be back in the post-acute space. That
Yes.
seems to be your passion, that phase of care.
It really is. Just, I spent, like I mentioned at the beginning, I spent so much time in inpatient rehab, and then that's just where I fell in love with, that whole continuity of care throughout.
Yeah. I think that that is something that's really special about nursing just as a profession. There are so many different little niches and areas and specialties and just phases of care that you can get involved in, and they're all so different. So it allows a
Absolutely.
lot of opportunity, whether it's like bedside jobs or non-bedside jobs, like you have those phases and specialties and kind of every level that you're working in. So it just provides, so many opportunities for where nurses can take their career.
Yeah, absolutely. And that's what's so cool about nursing, and that's what's so fun. When I hear of people thinking about nursing school, we'll talk a little bit about, I always ask them if I can give them my 2 cents worth. And then, I say, get a couple good years of med surge, cardiac, neuro, get a couple good years of that. And then your opportunities are endless with the direction you want to go into after that. And I said, the cool thing is, if you end up not liking one thing, you can always go back to bedside as long as you've kept, your skills somewhat up, or you can just find a different direction. That is my favorite thing about nursing is we can go in so many different directions. It's awesome.
Yeah, definitely. And I think too, I've been away from the bedside for about 3 years now. And I keep my nursing license active, and I haven't done like bedside skills
Mhm.
since I left. But it does help when I'm thinking about like making a pivot in my own career. I kind of think about like, well, what's like worst case scenario here, and like it's not even really worst case because it just means that if I really need a job, if push comes to shove, I can go back and I can get a nursing job. My skills aren't as sharp as they once were, but they're under there, if they just need some
Yeah.
dusting off. So I think that nursing does serve as just like, I mean, a great foundation to a career in many ways, just like the experience that we get, the skills that we develop, and that kind of like safety net that we get to take with us through other career pivots.
Exactly.
I mean, you've done like kind of a few different things, all kind of tangential to like quality and compliance. What advice would you give for others who are, maybe in one position and kind of looking ahead to the opportunities out there and what they might find interesting?
My biggest advice is if you're thinking about it, explore it a little bit and then just do it. The worst thing that's going to happen is you find out you don't like it. And then you can always go back to, and I don't want to say this like in minimizing bedside nurses, but we can always go back to the bedside. Um, we can take care of patients. I mean, we all got into nursing for that reason. So we can always go back to our roots. And, even if it means we try something, decide we don't like it, go back to bedside nursing, do that for a while to kind of regroup and see, okay, is this what we're meant to do? Or do we want to look at something else and then find a different direction to go in?
Yeah, absolutely. I think that that's really valuable advice. And I do think that too, I really agree with if you're thinking about something else, just do it, just try it. I think that that's really good advice. And who knows, like, you might love it and you might find a whole new path for yourself and open up all types of new opportunities. Or to your point, if you don't like it, that's a new data point that you have, and you have that to work with and base future decisions off of. And, sometimes after going to see if the grass is greener, you might come back to the same pasture and decide that you're good there. You might be more satisfied in that position. So I do totally agree with you. Just take advantage of the opportunities that we have as nurses, and know that you always have that, your actual like nursing skills and nursing experience to come back to. And so I guess any final takeaways on advice you would share from your experience in quality and compliance to nurses out there, just as far as like advocating for their patients and, the importance of, resources and processes?
When you're working through a problem, whether it's at the bedside or in quality improvement or even compliance, take it back to the basics. Most of the time, the issues that come up, or the problems, the headaches, are not as complicated as they seem. That if we just take everything back to the nuts and bolts and figure out what the root cause of the issue. I don't know if you've ever worked with 5 whys or have heard that. It's where you keep asking the question why to get to the root cause of a problem. Just keep doing that, whether it's, like I said, something at the bedside, an issue with your patient, something in quality improvement that just isn't clicking, keep asking why, or even in compliance. When I have to laugh, compliance is not scary. It should not be scary. And if it is scary, then something's wrong. Because when I took over for the compliance at that small hospital, the compliance officer before me had policies, multiple policies that were over 20 pages long. Kid you not, 20 pages long. And they read like something out of a PhD dissertation, or it was awful. So one of the first things that I did was took those policies and stripped them down to the basics, 1 or 2 pages long. And that's really what, we just need to get back to the basics, whether that's at the bedside stuff with the quality improvement or even the compliance. What is the basic? What does that person in front of you, whether it's a compliance issue or a quality issue, what do they need to know right now? And then the other stuff can be layered on top, but take it to the basics.
If you'd like to connect with Rachel after today's show, you can find her on LinkedIn. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, visit the job board at jobs.mypivotpath.com. And if you have any questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and we'll see you next time.